luckily the results were normal and it was not cancer. But even though I'm a fertility specialist, ma'am, I went on Google.
And if you're watching live, because we are live right now, we're going to now roll into the next episode, correct?
Okay.
Right, we are live, yes. So welcome, Dr. Garcia. Mm-hmm. She is the fertility specialist and CEO at Markham Fertility, and she's back on today to hear all things IVF. We're going to find out, we're going to rapid fire a few questions because she's so knowledgeable. She shared her fertility story on our last podcast, and we want to hear all about a lot of things. So everything fertility related. So I think
I just want to say I'm the co-owner and medical director of Markham Fertility Center. I guess that's like the CEO, but we don't actually have a CEO.
Owner, right?
Yes.
Thank you.
Very similar, but it's not technically a CEO.
Co-owner of Markham Fertility. Thank you for clarifying.
Okay, so I guess we'll go straight into it. And so if you didn't watch or listen to the podcast, go check out the last one because you're going to get the scoop about Dr. Garcia, who is an awesome human being, never mind an excellent practitioner. And but today, let's start with, people, they choose to do IVF, but there's a hesitancy because there's a fear. It's like, if I take fertility drugs, is it going to cause cancer? So let's have you speak right to that question, Dr. Garcia.
Yeah, I hear that question all the time. The short answer of that is does not cause cancer. There've been a lot of research done about it, and there've been no links between IVF and cancer. Unfortunately, there is a link between infertility and cancer, and that link is for breast cancer and for ovarian cancer. So there is a little bit of a link there, but the actual fertility medications or the actual process of doing IVF does not cause cancer.
And then we may want to speak to, it doesn't actually stay in your body forever, right?
That's right. The medications you take about 10 to 12 days, and they have a very short half-life. I remember, going back to my story, I studied this obviously when I was doing my training, and then I did IVF 5 times myself. And then I ended up with a breast lump and I needed a biopsy, and it was scary because I didn't know the results. Luckily, the results were normal and it was not cancer, but even though I'm a fertility specialist, ma'am, I went on Google.
Isn't that so funny, right?
Yeah.
And it doesn't matter how educated you are, how smart you are. It's that emotional stuff.
Oh, yes. Thank you for sharing that, because that's real. Yeah.
It is real. It doesn't matter what it doesn't matter what the research says. We still have fear. We still have fear.
So I went, so this was about, I think it was a year ago, but besides Google, I also went down all the papers again and all the research again and back to what I've known forever. So, and yes, the research is very clear. So this was very well studied by me personally when I was going through my own little cancer scare a few years ago.
Wow.
There was a little study, it was published a few years ago, talking about IVF babies having potentially higher IQs, but what they discover is IVF parents are usually very invested in their babies. Right. So it was a confounding factor, and they couldn't even prove it when you take away the confounding factors of the fact that, you're comparing with the general population, and usually these are parents who are older, have more resources, do all the things, the tutors, the schools and things like that. So that's great. And now Dr. Tanya and I actually discussed this a little bit as well, because there are people who are predisposed and may actually turn to the IVF clinic from their predisposition, might be having a higher risk for ADHD. Do you want to speak to that, Tanya?
Yeah, there was a little, I can't remember off the cuff which study that I did read. There was a slight increase, but recognizing that women with polycystic ovary syndrome, because of the excess androgens, they themselves have a higher risk of carrying children with ADHD because of, like, in utero, the higher androgens can kind of trigger the ADHD and
so the male hormones.
The male hormones. And then, technically, women make androgens.
Well,
too,
it's
so.
true, but how people, the public
testosterone,
identify.
yes,
Testosterone.
yeah.
That's a very good point. Yeah.
Thank you for saying that. Yes, 100%. We have
No.
all, men and women, people who identify themselves as male or female.
Yeah.
We all have every hormone, just in different ratios.
Yeah.
It's very difficult to pull this out because there's so many confounder factors and there's so many things that can cause ADHD and autism, and the real causes are not very well understood. Part of it is genetic, part of it is familial, part of it is environmental, part of it is imprinting disorder. So it's very, very difficult to get to the bottom of it. But I guess the best way to say it, there hasn't been a proven direct link between IVF and cancer, or IVF and autism, or IVF and ADHD.
Yeah.
Right. There's been a link with polycystic ovary syndrome and ADHD. So I guess based on that, because 30% or 70% of women with PCOS may have issues with fertility that could be slightly inflating that. And my son ended up getting diagnosed with severe ADHD. So I was like trying to figure it out. I was trying to do the research. And then I realized, it has nothing to do with the fact that I did IVF, and it's probably because of my condition. So I thought, you as a mom, as a doctor, you're like, why? What could I have done different? And to help prevent my patients from experiencing.
I wasn't aware, to be honest, of the link between PCOS and ADHD. So
me neither, not until recently when I was kind of madly researching, like back in the days that you did.
Now I have to look it up. That's interesting. I wasn't aware of that. Yeah.
So do you have any tips for natural conception?
Yes. There's certainly things to talk about, but I guess what I would like to start by saying is that it doesn't have to be very, very scheduled or very complicated. One of the things I hear a lot from my patients is, we got into a fight because I told him it had to happen right at this moment and he was doing something else, or we missed our window because he had a meeting and things like that. So it definitely, obviously, sexual relations is necessary for conception, for natural conception. It does need to happen during the window where fertility is at the highest, which is not necessarily the time of ovulation. So up to 5 days prior to ovulation, the sperm, healthy sperm, is capable of living inside healthy fallopian tubes. So if women have cycles that are regular, which it becomes tricky for women who do not have regular cycles, but for women that have regular cycles, if they have a 28-day cycle, then approximately between day 10 and day 16 is the window when conception can happen. And during that window, having sexual relations with the deposit of the sperm in the vagina can lead to pregnancy. If it happens every 2 days, doesn't even have to be every day. So this concept that we see on TV of like, it makes for great comedy, like, looking at the watch and, the pregnant, intercourse needs to happen right this moment and putting your legs up in the air. It makes for great TV, but it's not really all that accurate in real life. It does not have to be that constrictive. And I know from my patients tell me all the time how hard it is to have intercourse when it's planned, when it has a purpose, as opposed to when it is done for intimacy. So I know it's very hard to keep that balance, but I would say medically speaking, it doesn't have to be like that.
I love that you bring this up. And we did a whole episode on this that it just came out this week, actually, about, about sex and
when to,
and about how there's a difference between intimate sex versus baby making sex.
Yes.
And to your point too, and we spoke about this earlier, it doesn't matter. It doesn't matter how much you know and how scientific you are, but that emotional woman in you, I don't know about you, but I still put my legs up in the air, even though I knew I knew that like it doesn't matter about gravity. Like sperm are dynamic and they can swim, but I still pop my knees up, right? My back up.
Yes, you ever end up trying every possible thing that you read about on forums and on Dr. Google.
I won't even tell you all the things I tried.
Okay, see? So
I might have that from a chandelier or something.
Yeah. Oh my goodness. It doesn't matter. If they like say, put your feet in poop, I would have done it, right? Like,
Yeah.
you know? So,
oh my goodness.
Just in case it works.
Just in case.
Yeah, right?
Yes.
So like there's things that we know, and then there are things that we'll do despite it all anyway.
Yes.
So, and it's all okay. Like, you know, it's okay that I call it a temporary insanity anyway. It's like,
that's right.
You know, it's like you do crazy things when you're in this.
Yes. And recognizing that sperm can hang around for 5 days. So it doesn't have to be that exact time, like you're saying, getting mad at your spouse.
Right.
In fact, our second daughter was conceived that way. I was like, how am I even pregnant? Like I was waiting for a transfer. It was Christmas time. And, you know, so it's like, that's impossible. Like we didn't time it right. So, but apparently it was. So yeah, it's very important.
So I'm looking at our time, guys, and I'm just wondering if we could just have you back another time, because there's just so many more questions that we can go through. Would you be open to coming back for another session at some point?
Yeah, absolutely. Of course.
Okay, that's great. And then for those that are here live, we're going to get off and jump back on because Dr. Garcia has also graciously I convinced you, I guess, to speak to about deregulation of acupuncture, which is a current issue going on in Toronto, Ontario right now. And so we want to address this. So we're going to hop off and come back on so that we can address this, coming at it from a medical perspective, as well as, you know, the public health and safety issue, and basically the impact of what happens if we deregulate acupuncture, and just educate you in general about acupuncture in of itself. And we're going to be joined by Dr Garcia, who is actually waiting in the waiting room right now. But so we're going to hop off this podcast and jump on that. Okay. So
remember to hit save.
Yes, I'll hit save. I'll stop this recording and we'll jump back on in a second. So you guys pop back in. Okay. And everyone, thank you for joining this podcast. And again, look out for the previous podcast from Dr. Garcia, where she shared like so candidly her really heartfelt story. So you'll love this. We love her. We love you. It's a love fest.
Thank you.
Like and subscribe and share. Thank you so much.
Talk to you in a sec. Bye, guys.